Hi everyone, Mr. Wong from Supernova GP here. Today I'm going through one of the 2024 A-level question, and the question I'm doing is question 2, which is about universal healthcare. Now, this question I think is significant because it gives us some insight into the way Cambridge is looking at the essay questions. You will notice that for the past few years, they have had an emphasis on economic type of questions. For example, the previous year they asked about actually minimum wage and whether that is something that is realistic to implement in all countries. Before that, they talked about space exploration and whether it is justified for countries to be spending money on space exploration. So that seems to suggest that economics is an important theme at the A-levels, and that is one of the reasons why I would like to look at the economics question for last year, which is about universal healthcare. Now, the exact phrasing of the question is, how desirable is it for a country to provide universal healthcare to all its citizens? So there are several keywords within this question that you need to look at. Number one, how desirable? So this suggests that we are not just looking at the question from a theoretical perspective, but we also have to analyze the practical implications. So while we need to discuss arguments on a theoretical level, like if I have free healthcare, what are the benefits versus what are some of the drawbacks of free healthcare, we also need to examine the feasibility of it. Is it practical for countries, or what sort of countries is it actually practical for in terms of implementing universal healthcare? Are you a first world country? Are you a developing country? And even for these different types of countries, we also need to analyze how some countries are better equipped to deal with the situation. For example, America is a first world country as we know it, but it is also a country that is trillions of dollars in debt. So is it something that is practical and realistic for the United States to provide free healthcare? The other aspect of free or universal healthcare that you need to examine is what sort of policies are in place in countries that actually do provide universal healthcare. Is it really something that is free? So that is a question that you also need to address in your essay. You will know that for many countries with free or universal healthcare of some sort, they actually charge very high taxes. So it's not as though your free healthcare doesn't come at a particular cost. It is something that comes at a particular cost, and you need to be able to evaluate, is it a cost that the country is willing to bear in this particular question? Finally, the question also requires you to look at the idea of all citizens, which means regardless of the income status or the social status or whether the family is needy or not needy, you need to be able to provide free healthcare regardless of the income brackets. So that is what the question requires you to address. In many countries, you only provide free healthcare for people who need the services because they cannot afford them. So that's not what the question requires you to address. They want it to be a blanket policy where free healthcare is provided to all the citizens. So is that something that is equitable for the rest of the population? Those are important questions that you need to be able to address in this particular essay question. And that's why it's a fairly complex question that requires fairly good grounding in terms of economic concepts and understanding of how society works in general. Now, a reasonable stand to take for a question like this is to argue that while there are strong benefits to offering free healthcare to all citizens, that has to be weighed against the backdrop of the financial burden that is imposed on the country, and therefore we will argue that it is generally not something that is seen to be practical to implement in most countries. Your evaluation may then include a subset of countries that are in the minority that would be able to provide free healthcare at less of an economic cost to the country. For example, your Nordic countries, because they have large reserves and they also have good natural resources that they can tap on in order to keep their financial economy rolling. So that is how generally I would argue a question like that. So I will go into the essay to discuss, number one, what are the benefits of free healthcare for countries in general, and I will use examples across a range of countries. So we are not just talking about first world countries, but we are also talking about countries in the developing world where perhaps the equity issues are very severe, such that in theory free healthcare would be beneficial to these third world countries as well, especially for the population who are not able to afford them. From here, you need to go on to discuss the feasibility aspect. And the feasibility aspect here is quite straightforward. In order to fund your free healthcare, that would likely mean collecting taxes. And that actually evens out the equity issue, because generally speaking, taxation is a progressive tax. Income tax is progressive. The higher earners generally pay a larger proportion of taxes compared to the lower income groups, and in many countries, your lower income groups do not even have to pay taxes. That would be a significant way in which you can equalize the healthcare outcomes for the country between the rich and the poor through the use of progressive income taxes and then using that to subsidize free healthcare for everybody across the country. So that is one aspect to bring out the benefits of free healthcare, while at the same time arguing that it is not something that is impractical to practice. However, you can go on to evaluate that because your upper income brackets are more mobile within society, it is much easier for them to leave the country. if taxation becomes too high for them and they think that, there are other countries where I can actually go to without it being a significant hassle because I have the resources to be able to afford it. And if I were to stay in my own country, the taxes would be way too high. So that will result in a drain on the economy of these countries that choose to implement universal healthcare. So that is an evaluation that you need to be able to analyze, and you can use certain specific examples of countries where this has happened. Hong Kong, countries like Singapore are very popular with the ultra rich because of our relatively low income taxes. So if that situation was to change and the income taxes are found to be unbearable for the richer population within the country, actually instead of building up the economy to be able to sustain your universal healthcare, what is going to happen is that you are going to see a fall in your income taxes, and that will actually lead to your universal healthcare system not being sustainable. The other theoretical drawbacks of universal healthcare, you can refer to countries that do practice universal healthcare, like the British national healthcare system. So you would read about how inefficient the British healthcare system is. For example, if you were to go to see a doctor for even just regular GP because you have the flu or minor ailments like that, you could end up waiting in the queue for hours. When healthcare is free, it is prone to abuse. And that is the reason why for countries with free healthcare that are not effectively regulated, you would see that they often encounter problems with the healthcare outcomes in the first place because of the long wait times and how people over-consume healthcare. So those are the negative consequences that you need to cater for when you talk about any question dealing with free healthcare. So it feels like in theory, while universal healthcare is supposed to be positive for most countries because it makes your healthcare outcomes more equitable regardless of your income group, in practice, it can lead to actual worse healthcare outcomes because of the inefficiency that will be inbuilt within the system. So in summary for the question, number one, you need to address what the theoretical benefits of universal healthcare are, which is how it makes your healthcare outcomes more equitable. But at the same time, you have to talk about the practical ramifications, about the inefficiencies, and about how it could lead to a possible exodus of the higher income brackets of a country as a result of the higher taxes that are required to fund your universal healthcare. And furthermore, you can also talk about how your healthcare outcomes, because of the inefficiency, can actually become worse compared to become better, which is what is a universal healthcare is supposed to do for the country. Finally, you can evaluate how there are certain countries like your Nordic countries, your Scandinavian countries, and even a country like Singapore. If we were to adopt universal healthcare, we are perhaps a small sector of countries where your population is not massively overwhelming and your government has enough resources to actually fund your universal healthcare and make it sustainable for the general population. And the country is attractive enough, generally speaking, for your rich people to want to remain within the country. That is the kind of evaluation you can bring about across the question. So you weigh your benefits against the costs, and then finally you decide which part of the equation you want to stand on. So this is just a short analysis of the essay question. Of course, during our class lessons, we will break down the questions into greater detail. If you would like a deeper analysis of the different essay questions that come out at the A levels, or just learn how to break down the essay questions in greater detail, you can go to our website at gpsupernova.sg to find out more. Once again, I'm Mr. Wong. See you soon.